I was inspired to write this piece because so many stories were popping up, and there's probably so many that weren't being heard about Black women, not just in higher ed, but in other professions, leaving under really horrid circumstances. And one of the things I said to myself, and I said to my friends, some of whom are here, and I'm really glad to see them. I want to shout out Dr. Brittany Lewis, Dean Nisha Bochwe. I want to shout out Tanisha White. I want to shout out Dr. Lori Ouellette. Those are some folks who I met at the University of Minnesota who I could count on to have my back. And what is still too true for too many Black women in leadership, as well as Indigenous women and other women of color, is that when they take positions of leadership in predominantly white institutions, they can only count the number of people who have their back on one hand and maybe only on one finger. And the amount of stress that that creates and the stress you bring back home, people have written extensively now about the topic of weathering, and I'd be interested in that early retirement statistic for women in elected office and how they get weathered by the kinds of questions and micro and macroaggressions and threats that Mary Moriarty talked about. It's what Patricia Williams called soul murders, death by 1,000 cuts. And it shouldn't be that way. So I wrote in my journal when I decided to leave higher ed that I would inherit all of the gray hairs denied my ancestors. Because as one of the badasses said, we've never had a real healthcare system in this country, mental or physical, and especially not for Black women who started out as being experimented on. So all of those things spurred me to write that piece and to ask people to see themselves in it, even if they weren't a Black woman. And so that's why the piece ends with those reflective questions about what kinds of expectations are you putting on people who you're bringing in to solve a problem that's 400 years old? And how little expectations are you putting on yourself? So those are the kinds of things I want people to think about, not just to hear my story or look at the stories in the news, but actually see themselves connected, because we're all connected.
I'm going to ask you one more question, which is related to sort of we had a coffee conversation a little bit about the caretaking role, the caretaking burden. It's also part of the May issue story, the vulnerability of trying to connect honestly with each other. Because again, the goal of everybody that's here today is related to the fact that we really need to learn how to care about everybody much better and to push back against those that don't see the value in that. So I'm wondering if you have a few other thoughts related to what you would like to see happening differently as we talk about collective health.
Well, I want to go back to Janata's poem and book. Let's literally fund the grandmothers. Let's literally do that. People love to say they're doing community engaged work, and Dr. Brittany Lewis could give a seminar right now on this, and that's why I'm proud to work at her side as well. But people say it, philanthropists say it, politicians say it, but there's still this little belief, it seems, that if we give those people a bunch of money, they're not going to do it right, or they're not going to do it the way I think it should be done. And so I'm going to put a bunch of strings, and I'm going to ask them to fix a 400-year problem in 1 quarter and give me a report about it before the next quarter, right? So I really want folks to understand that you can't just say you're going to work with community. You have to be willing to share power with community and share resources with community and take a step back. Because if you care about community and public health, then you have to let communities take care of their health.